Hi, welcome to Community Health Journal. We start today with a lifelike look at life-saving. Before a newly hired nurse gets to the bedside, their training and orientation puts them to the test with patients that are as close to human as you can get. They are tested with simulated patients using state-of-the-art technology that mimics real-life medical situations. We recently got a demonstration of this fascinating and high-pressure program at Cadlick Regional Medical Center.
Start CPR again. Okay, let's go ahead, let's draw epinephrine.
This is about as realistic as you can get when it comes to training newly hired nurses. Under the watchful eye of knowledgeable educators, nurses go through simulation training. This session, we invited 3 Cadlick Emergency Department nurses to showcase their talents. All have previously been through this training, and today credit it as the key in their ability to expertly care for patients in intense situations.
Terrifying at first, but then you get more comfortable, start going through the scenarios, and you feel more comfortable. And then when you go down to your floor and actually dealing with patients, it makes you a lot more comfortable when you're working with actual patients.
You know, it's kind of a tough thing to step into an actual code, as we call it, when someone's, in need of life resuscitation and all that. So, getting to do this kind of is the closest thing we have, and the more you do it and here, the kind of more comfortable you feel when you actually get out there and do it.
Definitely the more you do it, the more comfortable you get with it. And so we've done multiple simulations where the patient codes, and at some point someone goes and grabs the crash cart, someone is hooking up the pads, someone is starting CPR. It gets to the point where you know that someone is going to be doing one thing and you need to go do this thing. So it is nice to know that when that scenario happens, you're ready to go grab what you need to grab and do what you need to do to help the patient the best you can.
The patient's name is Stan. While clinical educators Narda Leeming and Cindy Martin test the nurses in the simulated patient room, Mike Anderson, who oversees what is called the Sim Lab, programs Stan to test the nurses on their life-saving techniques.
It is the best educational tool for training people to be proficient in the clinical environment without putting patients at risk or having bad repercussions from making mistakes. It's actually an environment where we encourage them to make mistakes so that they can learn what not to do and be more proficient.
Do this, they just seem so calm.
It's because we were able to take them and practice with them and do it over and over and over again till those skills became more rote. And they weren't always necessarily thinking about them, they were just doing, with being able to think at the whole picture rather than just the task that they were accomplishing.
One of the things that I always tell people is the first thing you do before you walk into the room is take your own pulse. Just take a big breath, slow down, because it's an anxiety-driven procedure that we're doing. We have patients whose lives are at stake. And so we want to be able to do this in a calm manner, and so everybody knows their roles, and that's what's so important about code training, is that we do it in a safe place. You can make safe mistakes in a safe place, and then we can talk about it afterwards.
Anderson can program in real time, changing patient vital signs. Cameras in the room also record the sessions, so the teams can review and discuss what they learned afterward. All of these nurses are bachelor's educated. Their simulation training to work in the ER happened each week for 12 weeks before they started taking care of real patients. To a person, they say the simulation is incredibly important. Their instructors say the ultimate winners are patients.
This means that we're able to provide the highest quality care to each and every one of our patients that come through the door, and that we know that our nurses have received the best education and the opportunity to make those mistakes early on rather than with a live patient. And so that makes them more confident in their role at performing those tasks at the bedside. And that's what we're all about, is confidence in that delivery, because if we're confident, then our patients are able to feel that confidence and they're safe.
If you want people to be good at what they do, they need to practice, and they need to practice in an environment where they don't hurt anybody. So if we can come up with an electronic device that mimics everything that they need to see and do and feel, then their skill sets are going to do nothing but improve.
There are other mannequins involved in training, including tiny simulated infants. Our thanks to the team for allowing our cameras to share this valuable training exercise available at Cadlick.